I think we'll go ahead and get started. I'd like to welcome you to our June CPC Education Center webinar. Make sure that you are not using both your speaker, computer speaker, as well as your phone at the same time, because you get a lot of feedback from that. Everybody is on mute right now. If at the end you have questions, you can unmute yourself by doing #6 and then mute is *6. So you're also able to leave us questions or comments in the chat room, and we will get back with you on those as well. So I also want to remind you to fill out the feedback form at the end of the program. I also want to let you know that we will be recording the webinar, and the slides will also be available later on our website. And I encourage you to join us next month for our webinar that will be on July 26th on the nuts and bolts of the transplant process. Today we're going to talk about chronic pain, and I think many of us experience chronic pain. And so we're going to learn more how to manage it. Our speaker today is David Spero, and he's been a nurse for 40 years and has lived with multiple sclerosis for 30 years. He knows chronic illness from inside and out, and he's written books on self-care and on diabetes. He writes a column every week on diabetes self-management, as well as magazine articles about chronic pain. David also presented for us last year on the topic of sex and intimacy with CKD, and you can also view that recording on our website. David, I turn the program over to you now.
Well, thank you, Kathy, and thank you for having me again. I enjoyed last year with sex and CKD. This probably isn't going to be as much fun as that was, but I hope it will still be helpful and informative for people. And I noticed that we have some real pain experts in the audience here, so now I'm nervous about how well I can do this. Hopefully there'll be some things, in, some different ways of looking at it in here. Pain is a huge issue, not just in CKD, of course, but in America, as we can see. We'll find out more as the talk goes on. And I'm a nurse. I'm currently not really actively working in a hospital or anything, but I'm doing health coaching, and a lot of my clients turn out to be people who have chronic pain. They seem to be the people who are seeking help. So I have experience with that too, as well as my own. And from having chronic illness, I wrote this book, The Art of Getting Well, Maximizing Health When You Have a Chronic Illness, which is all about self-care. And then later on, I found out that there was more to it than self-care. And I wrote this book, which you can't see the title, but the cover, but Diabetes Sugar-Coated Crisis, which is about the social causes of the illness and social approaches to treatment and prevention, which are very relevant to kidney disease too. And these are the magazines, Diabetes Self-Management and Pain-Free Living, that I write for. And a lot of what I'm going to say today has been in articles that I wrote for Pain-Free Living. It's a really good magazine, in my opinion. And that's my blog, The Inn by the Healing Path. And I encourage people who like spiritual stuff or healing stories to check that out. The Healing Path, the innbythehealingpath.com. And that's me, at least that's me as I was about 10 years ago. Today I'm going to talk about the causes of pain, especially the causes of chronic pain, and what the treatments are, and how we can self-manage, and why it's such a problem, and such a big problem. But it is something that can be dealt with, that can be helped, that even can be healed in many cases. Okay, so what is pain? That's the first thing. I mean, you know what pain feels like for you, and I know what it feels like for me, but what is it in general? What is pain's purpose? Why do we have pain? And pain is the body's way of warning us that something is wrong. You pick up a hot coal or something, you're going to get pain. And drop that. It's the way of warning us that something is wrong, something needs to change. It's a symptom usually of bodily injury, which can be an external injury, or it could be something going on within you, like a tumor, say. Emotional injuries can also hurt. So it's helpful to think of pain as a gift, at least it is for me. It's not a gift that we want. It's not a gift that you want too much of. But without it, we wouldn't last very long at all. You think of people who have diabetes neuropathy in their feet, and the feet are numb, and you can't feel any pain. And so you could have a stone in your shoe, you could step on something sharp, you could have an infection going in your foot, and you wouldn't know about it. You don't know about it because it doesn't hurt, and then you can get in huge trouble. So pain is necessary, pain is a gift. But it's not a gift we want too much of. There's two major kinds of pain. Are acute pain, which is a sign that tissue is injured. There's an actual injury happening now, either internal or external. Stop what you're doing or move away. Move away from the fire. Stop walking on that ankle that's broken. And it goes away when injury is healed. So acute pain is the life-saving quality of that is fairly obvious. Chronic pain is different. Chronic pain doesn't go away when the injury is healed. It persists. It's defined as pain that lasts more than 3 months. Often there's no apparent biological cause, like on an x-ray or a physical exam. There might be, but there might often not be. And it can be extremely disabling. And common sources in the general population for this include back pain, headache, arthritis, and abdominal pain. There are other sources that are common in people with CKD. Chronic pain is a whole body condition. It's especially a condition of the nervous system, but the whole body is involved, and all the neurotransmitters and other chemicals that the body produces are involved in making the pain better or making it worse. It's trying to warn us about something, but frequently the warning system has kind of gone awry. It's warning about things we can't actually do anything about. It's not like drop the hot rock, because there is no hot rock. Maybe there used to be, but it's gone now. But the system is still telling you that. Something is wrong. Change something. The body has very few ways of signaling us. When you think about it, there's pain, there's nausea, vomiting, and maybe itching, maybe one or two others. But pain is the main way that the body has of talking to us. And so it will use it in ways that we can't always understand, or that is not at all helpful to be warned in. Some of the things that might need changing would be get a new job, or get your blood sugar down, or something about a relationship that you're in. All these kind of things can add to your pain. But by identifying the cause is not easy. Chronic pain is usually associated with feelings of helplessness. It's closely related to depression and anxiety, I'll talk about in a minute. And the causes can be physical, like body injury, psychological, can be thoughts, emotional, feelings, spiritual, like what am I doing here? Why is this worth it? What's the point? Or again, there can be social causes. Social oppression currently, frequently leads to pain and chronic illness. And it's very prevalent in CKD. According to studies that I read, these are just from last year, one said that 60 to 70% of patients in advanced kidney disease have significant chronic pain. And another study showed that it was the most common symptom reported by renal patients. So it's really common. If you've got it, you're not alone. I don't want to ask how many people in the audience have it, but I imagine there's quite a few, or at least you live with people who have it. Chronic pain is also prevalent in diabetes, and extraordinarily prevalent. Rebecca Sador is a pain specialist, and she wrote, she's an MD, adults living with type 2 diabetes are suffering from incredibly high rates of pain at levels similar to patients living with cancer. I mean, that's pretty strong when you think about how painful cancer is. And you have to ask yourself, you could ask yourself, why is that? I mean, CKD and diabetes are painful, but they're not as painful as cancer, generally speaking. So why is that? And it's been studied. There's a lot of information on it. I wrote a chapter about it in my diabetes book. But the short answer is stress. I mean, the stress of living with a chronic disease like CKD or type 2 diabetes can greatly increase our sensation of pain, and that's the short answer, and that's all you're going to get from me. Why? The immediate causes of pain in CKD, according to journals that I read, include neuropathy, diabetic nerve pain, arthritis, bone infection like osteomyelitis it's called, and there's various surgeries and treatments connected with dialysis. And I noticed when I put that list together that all of those things could be acute pain, and they can also be chronic pain. You know, because if you've got neuropathy, the nerves could be being damaged right now, which would cause acute pain. And there can also be, you get used to it. The nerves are getting sensitized to this arthritis or whatever it is, and so that they get more sensitive and are over-reporting the pain. Pain from any source can become chronic under the stress of CKD. Dr. David Bressler is a psychologist I used to work with, and he says depression is emotional pain. Just defines it that way. They're the same thing. I think that's pretty close to true for most people. Dr. Karen Burt Amira is a pain specialist in Contra Costa County out here where I live, and says, I don't think I've ever met a chronic pain patient who wasn't depressed. It's depressing. It's fatiguing. It wipes you out. Pain is so exhausting, she said. It requires constant vigilance, causes tension all over the body, and that wears you out. And when you can't do things because of fatigue, that is depressing. It makes you feel useless. It makes you feel hopeless or powerless, and those are all major symptoms of depression. So, and all of that contributes to pain. So pain, depression, and fatigue, especially pain and depression, are basically elements of the same thing. The basic pathways of pain, both acute and chronic. There's a site of injury, current injury or a past injury, or an internal injury or an external injury. And then there are the nerves that send the signals, pain signals, that go through a series of nerve centers or nerve ganglia, which are basically just nerve cells that are sometimes called pain gates, although we don't know exactly what they are. But as they go through those cells, the pain signals can be amplified or they can be subdued depending on what neurotransmitters and what chemicals your body is secreting at that time. And then the signals are received by the brain, and they are interpreted by the brain as being more dangerous or less dangerous, more severe or less severe, depending on what else is going on in our lives and in our bodies. So all these areas of pain gates and the brain and the site of injury can be affected by anxiety, by stress, by illness, and by turning up or lowering the intensity of the signal in the pain gates. And this is a visual of it for those who are looking on screen, that something's happening in this image that's in the back. It goes through some neurons, some peripheral nerves, and there are different nerves for acute pain than there is for chronic pain, but they all go to the pain gates, and in these gates, there's a series of them. They can be turned up or turned down, and then they get to the brain where they can be seen as more or less severe. Trauma is the most common cause of chronic pain, and that's not always recognized, and your doctors may not recognize it. Trauma is injury that comes about in a condition of fear and of helplessness. For example, like in an accident, or let's say an assault. You're being beaten up and you can't do anything about it. The people are much more powerful than you. So you've got physical injury that causes actual pain, damage to tissues, which causes pain. You've also got fear. You don't know what's going to happen. You could die. And you've got helplessness, that you can't do anything about it. So in the situation of traumatic injury, your body wants to fight or flee. The fight or flight response is the normal response to stress. But if you can't do anything about it in a traumatic situation, the third alternative is to freeze. They say fight, flight, or freeze. And freezing is a way of protection. It's a life-preserving thing, but it involves, freezing the body up, and all that pain, all that trauma gets embedded in the body, and that can stay there for life if it's not treated. We'll talk about treatment later, but traumatic memories are kept alive and very close to the surface to protect us from being injured again. Here's the situation is coming again. Get out of here. And because it's so close to the surface, it can be very easily triggered by a scary thought, by any emotion or any physical thing that happens. It can be easily triggered, so that sometimes chronic pain is basically remembered traumatic pain. And that doesn't mean that you're doing it to yourself or it's your fault. This is a normal reaction of the body to trauma, but it's a common cause of chronic pain. Some causes of trauma, which I will read for people who are on phone. Accidents, assaults, abuse, sexual abuse, emotional abuse, child abuse. If I think about the children down there being separated from their parents at the border and being put into detention centers or cages, those kids are being traumatized. They will have chronic problems later on. They will very likely have chronic pain because of this, and they will probably need treatment. War is a very common source of trauma, obviously. The last two on this list are really, really important for people with chronic conditions: medical treatment and surgery, because both medical treatment and surgery have all the elements of trauma. They're something we are not in control of, and they are scary, and they cause pain. So anybody who's had a lot of medical treatment or anybody who's had surgery has been exposed to trauma. Whether you picked it up or not, that's an individual case, but quite possibly you did. And trauma is usually worse when it happens in childhood, when it happens repeatedly, or if it's still happening, which is frequently the case, especially with emotional abuse. And trauma is something you need to deal with to get clear of chronic pain. Okay, so that's the causes. That's how it works in the body. What's it like to live with chronic pain? I say chronic pain can be lonely. Other people can't see it. They may not be able to imagine it. They certainly can't experience it. They don't know what you're going through, and they may not believe it. The great British scholar Samuel Johnson wrote that those who do not feel pain seldom believe that it is felt. And that is really true. And it's not just true of physical pain, but people, I don't believe that the oppression you're suffering is really serious, because I'm not suffering it. But in the case of pain, it's automatic. People can't see it. They may not believe it. And they may have no sense of how limiting your pain is and the problems it causes for you. And that could be true of family, of co-workers, or of health professionals. And people might want to help, but have no idea how to help. And the stress, the loneliness of this is the stress of having to live your life, meet your responsibilities to family or to work or whatever, when your body is screaming at you to stop and rest. And you have to keep going. You have to decide for yourself, what can I do? What can I do? And how am I worth it? And how the hell am I no longer worth being here? It's really stressful. So the only way to get people know is to talk about it. Dr. Stephen Richheimer, a pain specialist, says, don't be shy about your pain. Doctors have no other way to measure or understand it other than the description you provide. And we don't always provide good descriptions. We don't want to talk about it because it's uncomfortable to talk about. It might be embarrassing. We don't want to be seen as complaining. I had a client who said she didn't tell her doctor that his treatment that he recommended was not working because she didn't want to make him feel bad, and she didn't want to be seen as whining. She said, you need to please these authority figures. So these things can get in the way of talking, and it's not helpful. But there are other problems that we don't have vocabulary for it. Some people, it's not uncommon, do not know how to talk about pain. Especially this can be a problem if the person you're talking to does not speak the same language as you. Because a lot of times people don't know the words for pain in their own language, much less in other people's language. I've got on this slide a list of pain vocabulary of words that are used to describe pain. This is from the Arthritis Foundation. It's only half of the list that they had. It was a really long list. But they had terms like stabbing, and throbbing, burning, tingling, hot, pressure, aching, shooting, sharp, pounding. There are many ways to describe gnawing pain, and each of these descriptions are usually associated with different conditions. So it's very helpful to your doctor to have this list. And there's a link to the list on my resource page. There's a resource page at the back. It doesn't have a lot of resources, but there are some that you can get more information on this. Cramping, piercing. Those adjectives are very vivid and should give people a pretty good, some feeling of what you're going through, but they don't always cover it. Sometimes they don't give the whole picture. Sometimes a simile is helpful. A simile is, it feels like my leg's on fire. It feels like someone's standing on my chest. I had a client who told me, it feels like somebody's got my foot in a giant pliers and they've twisted it around halfway. And that was pretty vivid. So that's another way to talk about pain. So these are things to describe the intensity, and describe the way it feels. But the quantifying it is harder, and that's where people use the pain scale. And I imagine you've been exposed to it because they ask about it all the time whenever you go to the doctor. On a scale of 1 to 10, usually, with 1 being no pain and 10 being the worst pain you can possibly imagine, where would you rate your pain? And that is very hard to use. It's very hard to use right and be clear about, because do they mean how is the pain right this moment? Do they mean how has it been for the last week or month? Or it's very difficult to understand. And different numbers mean different things to different people. 1 and 10 are pretty clear. 10, the worst I can possibly imagine. But what's a 6? What's a 4? It's important not to exaggerate. People tend to exaggerate. I have a neighbor, Pat, who has severe knee pain, and a few weeks ago we had a birthday party for her granddaughter, and she was out there barbecuing, and you could tell by looking at her face that she was in pain. And I asked her, well, how's your pain today? And she said, oh, it's bad. It's a 10. And I said, no, it's not a 10. If you were at a 10, you're not out here barbecuing. You are lying in bed thrashing around. Natural childbirth without medication is considered an 8. So that tells you what a 9 or a 10 must be. There's a website on the back that you can gives a better breakdown. But in general, 1 to 3 is considered mild pain, meaning it's annoying, it's bothersome, but it doesn't really stop you from doing things. 4 to 6 is moderate pain that interferes significantly with your activities. And 7 to 9 is severe pain, which is disabling. Can't do much of anything. And so there are gradations within that, obviously 7, 8, 9, 4, 5, 6. And you can look up more about what that's supposed to mean. But it means different things to different people, so you can't be precise about it. But don't exaggerate, because if you do, then the doctor will start to discount everything you say. They'll say, well, this person is just exaggerating. Okay, that's about the intensity of pain, but describing the nature of it is important. How the pain limits your life is really important for doctors and therapists to know, and also for family to know. Dr. Pauline Schneider said gives the example, I can only stretch my arm this far. I can only walk for so long because of pain. Saying what brings it on, what makes it better, what makes it worse. All those things are important to know. And you want to do the things that make it better and not do the things that make it worse. And so where in your body the pain is it intermittent? Does it come and go? Or is it constant? Does it come and stay? And especially, how often do you get it and for how long? Because you think about it, say you have a terrible intense pain, say it's like a 9, but you only get it for 10 seconds once a day. It's scary, but you can live with that, much better than you could probably live with a 7 or a 6 that you had all day long. So all that's important to tell people. And how pain is affecting you right now, because people don't understand that it changes, that you have good and bad days, that you have good and bad weeks, good and bad hours. And so you say no because of pain too many times, they might stop inviting you, and you don't want to stop being invited. So tell people about that pain changes. Today my pain's a 7. I can't handle going out now. Maybe we can do it tomorrow. Or today I'm doing better. My pain's a 3. Let's go. Okay. So treating chronic pain. There are many, many ways to treat chronic pain. Medical, non-medical, and self-management. Medications. I mean, everybody in America at least starts with medications as being the number one thing to do. And that's okay. And there are 6 different categories of medications used to treat pain, which tells you that how much pain there is. All of these 6 categories are selling a lot of product and making a lot of money. So there's a lot of pain being treated. Narcotics, which are now called opiates. I'm used to calling them narcotics because we always used to. And 30 years ago, 40 years ago, this was the only treatment, the only medical treatment. And it's still widely used, but they're not probably the best. They are useful. Narcotics work on the level of the brain. These different drugs work at different levels. Different treatments work at different levels. The brain, the nerves, or the site of pain. And narcotics pretty much work in the brain. They reduce the brain sensitivity to pain signals. There are many products like codeine and fentanyl, morphine, and synthetics like methadone, street drugs like heroin. There's a lot of them. They're much harder to get now because of the social fear over addiction. By the way, I think Beth is still out there. There's a really good article on the website right now, Beverly, about chronic pain, about pain in CKD, and that's totally worth reading. So don't forget to read that. But it's harder to get now because of the fears of addiction, which may or may not be overstated. There are side effects, though: constipation, nausea, dizziness. They're great for acute pain like injury or surgery recovery. They're not so good for chronic pain because your body develops a tolerance. It doesn't work as well over time, and it doesn't treat the nerves or the site of injury, so it's working only on one level. Some that are used more often now are seizure medicines, and this makes total sense because chronic pain and seizures are both symptoms of oversensitive nerves. So seizure medications can help. Frequently prescribed are Lyrica and Neurontin. They have some side effects. They don't work for everybody. Even the older anti-seizure medicines like Dilantin and Tegretol do have an effect of relieving chronic pain for a lot of people. So those are worth looking at. Then you get into some that are a little harder to sell, like anxiety medicines or anxiolytics. Anxiety is unfocused fear of you don't know exactly what it is you're afraid of. And nearly everyone in the world has some anxiety, and you have more with illness like CKD. So this is not saying if a doctor recommends an anxiety medicine for your chronic pain, they're not saying, hopefully, that it's all in your head or you're imagining it or you're just nervous. Anxiety contributes to pain. It makes the pain gates more sensitive because you're in more danger. The body believes it's in more danger. So it makes sense to treat the anxiety. There's the benzodiazepines like Valium and Xanax that people know about. There are newer ones like Buspar and Wellbutrin that probably for a lot of people work better. I'm not saying you should take them or you should take them for a long time, but they are helpful. Same with antidepressants. Some people go, I'm not depressed, I'm in pain. Well, if you're in pain, there's depression involved. And quite possibly, depression medicines can help the pain. So the old-fashioned, well, the widely used ones like the SSRIs, Prozac, all the other varieties of antidepressants can help. Wellbutrin makes it onto this list too, as well as being an anxiolytic. I like Wellbutrin because, unlike other antidepressants, it does not deaden your sex drive. It may actually increase it. So I like that drug for a lot of things. And before you even get to those, I mean, probably everybody who has pain might consider taking anti-inflammatories, which are usually over the counter, like ibuprofen, Motrin, aspirin. There are prescription ones like Celebrex and Salsalate that are a little stronger, because inflammation is almost always present in pain at some level. So if the inflammation after an immediate injury or an infection or something is needed, it's a good thing. You don't want to suppress it. But if the injury and infection are no longer there, but you're still having the pain, then it makes total sense to take anti-inflammatories and reduce the inflammation. So there's a lot of ways. And then there are alternative medicines. And as I look at this list, I noticed that I've taken all of these. Magnesium is really good for relaxing tense, painful muscles. Capsaicin is usually an ointment or an oil that comes from chili peppers or from cayenne pepper, and you usually rub that on. Arnica is a homeopathic remedy, which means that a lot of Western doctors will scoff at it and say it doesn't work, don't bother with it, but it does work for a lot of people. There are 100 products out there that you can buy at drugstores, creams, or health food stores, creams to put on your pain, and you can check the ingredients, and there's frequently arnica in there, and it does help. And then there's cannabis. If you live in a medical cannabis state or a generally free cannabis state, you're in luck, because this is really valuable for pain. It relieves anxiety, depression, and chronic pain. It can be rubbed on or it can be ingested. The problem with it is that one of the ingredients, at least one of the ingredients in cannabis, THC or tetrahydrocannabidiol, gets you high. And as a result of that, you probably won't be able to do very much when you've got THC going in your system. However, there are versions out there now, there are forms, there are products that don't have very little or no THC, and they just have other elements called, like, especially CBD or cannabidiol, which has all the beneficial effects and doesn't get you high, and you can apply it on your skin or ingest it. So there's a lot of ways to treat, a lot of medicines, I should say, all kinds of medicines, and you should look into them. There are also non-medical treatments, and I've got a list here on the screen of 10 of them, which I'm not going to read because I'm going to go through them, but that's probably not a complete list. It tells you how many different ways there are to treat chronic pain. There's no reason to give up. Acupuncture, chiropractic, and osteopathy, they all need highly skilled, trained practitioners to do them. And acupuncture involves, putting needles in your pressure points and helps energy flow in the body, helps the nerves flow better, helps energy flow better, helps your general health, which will help your pain. Chiropractic adjusts the spine to help nerve function. Osteopathy adjusts various joints, including the spine. And all of these treatments typically will take some time to work. It won't be the case that you'll get one treatment and you'll suddenly be better. But over time, they will help. So stick with them. Nerves and muscles can be treated. Nerves can be blocked with medications injected into the nerves to deaden them, or they can be stimulated with electrical stimulation, which will stimulate other nerves that compete with the pain signals. And that's typically done through a patch on your skin, which is usually called a TENS unit. There are versions of this now, but that's the original. TENS stands for transcutaneous electrical nerve stimulation, meaning it goes through your skin to your nerves. And then there's massage. That helps. There's physical therapy, which is really good, especially for addressing some of the underlying causes of physical pains, more acute pain. And massage, touch, relaxation, heat or cold. And there's a thing called anodyne therapy, which you can look up, which involves warmth and gentle vibration, usually used on the feet, to improve circulation, improve nerve function, and reduce pain. And there are mind-body treatments like muscle relaxation, guided imagery, biofeedback, or hypnosis. And there is cognitive behavioral treatment or therapy or self-talk. You can go to a cognitive behavioral therapist, or you can sometimes do this yourself. You can adopt what I call more realistic self-talk. I don't push positive self-talk. People talk about that, but not everybody is positive or can be all the time or should be. But most people are unrealistically negative. And if we can change those unrealistically negative thoughts to more realistic ones, you may feel a lot better because you will be less stressed, you will feel less afraid. For example, an unrealistically negative thought, I can't stand this. Well, you can stand it because you are standing it. But that's the way you feel. I can't stand this. But if you can change that to a more realistic thought, I can barely stand this. Feel the difference in that. You're basically saying the same thing, but one is much more stressful than the other. Or, I'm no good to anyone anymore. Is that realistic? But people think that. It's unrealistically negative. A more realistic thought is, I can't do what I used to do, but I still help. I do the best I can. And so on. I mean, there are a wide variety of negative thoughts that people have. You have to change it to a thought, a realistic thought that you believe, that you can. Telling yourself, oh, I feel great, isn't going to work unless you actually do feel great. But you come up with a thought that works for you, and you practice it. You have to practice a lot. It's okay to take help, to get help with that. There are therapists who make their whole living helping people with that. We have to treat trauma if there's trauma. I shouldn't say we have to, but basically, if you want to get rid of the pain, you have to. Trauma is stored in the body and will stay there for life if it's not released. The typical way, the traditional way of trying to deal with trauma was through psychotherapy, talking about it. That doesn't really work in most cases because it can, if anything, it might re-trigger the trauma. Talking about it doesn't make it go away because it's in the body. So psychotherapy can help some people, but these newer techniques are better. Like somatic experiencing was invented by Peter Levine and Maggie Phillips, a couple of psychologists. And somatic experiencing is you try to remember a little bit of the trauma, not a lot of it, just a little bit, and feel that in your body and practice a movement in your body that gets the trauma out. Like if you were assaulted and you couldn't run away, you were trapped. In somatic experiencing, you might remember a little bit of that fear and then start running in your imagination or possibly even really. And you can actually process these trauma out of your body this way. It takes some time. It takes a skilled practitioner, a skilled therapist. Eye movement desensitization and reprocessing, or EMDR, can be very effective. I've experienced this. You're following lights with your eyes, and it puts you in sort of a dreamlike state, and you might be remembering something really painful or really stressful, and the pain just goes away. And it's because it puts your brain into a state where it's much easier to process things and get rid of them. It doesn't, it works for a lot of people. Emotional freedom technique is a self-care technique. You don't need a therapist for it. You can see how to do it online. It involves tapping on your various parts of your body while you think about the things that you want to change. So there are ways to deal with trauma, and it's totally worth doing. There are nutritional approaches to pain. Foods can inflame and foods can soothe. Different foods for different people, though. Some foods that cause problems for a lot of people and not for others are gluten, meats, some additives, citrus fruits, sugars. Those can be bad, or the nightshades, tomatoes, potatoes, green peppers. But you won't know. The only way to know, you might suspect, you notice if when you eat something you feel worse, okay, that might be a problem. How do you find out? And the way to find out is with an elimination diet. You may get rid of the foods that you suspect of causing trouble, or you might get rid of all your foods except for a few things that we know never cause problems or very rarely do. And then you slowly add things back in until the pain comes back. And when it does, then you know, well, that's part of the problem. I get rid of that and never have that again, or at least not for a long time. And then you go on and add the next thing. And by the time you go through the whole list, which may take a couple of months, you might find you have a list of 2, 3, 4 foods that you can't eat. It's not going to be like you're going to wind up not being able to eat anything. It'll be a short list, but it's worth doing if food is involved. There are also foods that are good for you. Sweet potatoes tend to be good. Leafy greens very rarely cause pain. Ginger and turmeric, omega-3 oils can all be good. Glucosamine and peppers, hot peppers like capsaicin. So nutritional approaches can help. Exercise, of course, is always good. Everybody needs to move. Yoga, Tai Chi, these are kind of gentle exercises that won't hurt you. Water exercise. I have a client right now whose exercise, and does it several times a week, is just to go to the pool and walk in the water, because he has too much pain to walk on dry land. His balance isn't good enough. So there's that. If you can do more, do more. Walking, biking. Strengthening is good if your body's up to it. You don't want to usually do things that cause pain, but you want to do what you can do. And remember your general health. And okay, so if you have diabetes and you've got neuropathy, you want to lower your blood sugar. If you've got headaches, it might help to lower your blood pressure. You might want to do all the general health things that people do: stretching, strengthening, resting, meditate. Your general health level and your feeling of wellness affect how sensitive your nerves are to pain. If you feel confident in yourself, I'm healthy, I'm not dying here, I'm okay, I have strength, you are going to tend to feel less pain than if you're feeling weak and fragile. So it's worth doing all of that. And then the self-management approaches, of which there are also many, and we're actually going to do 1 or 2 of these. Probably just one because it's getting late. First one is distraction. They always teach this in self-management programs. Like if don't obsess about your pain, do something else in your mind. This is very good for acute pain, like if you're going to get a shot or a medical treatment. Put your mind on something else and don't pay attention to the pain. You can play games, you can play Sudoku, you can count by sevens, you can watch TV or the internet, you can read, you can work. There's a lot of ways to distract yourself in this society. Now people are chronically distracted, excuse me, and distress. So distraction really isn't hard to come by. Distraction is easy. You can socialize, you can remember things, you can see beautiful things. I put sex and love on this list. Not really strictly distraction, but sex is a great pain reliever. So I'm still on about that. And love, of course, will make you feel better and should reduce your pain symptoms. But that's easy. But I want to practice, and I want to suggest the opposite of distraction. I wanted to suggest focus, giving more attention to the pain. Don't splint it. Don't try to avoid it. For a little while at a time, not all day long, but for a while, give more attention to the pain. So focus on it. So right now, I'm asking you to identify a place in your body where it hurts. You don't have to be in severe pain to have this. Everybody's got a little pain somewhere. And if you don't, find something else like tension or itching or something else that's a little bit unpleasant. And just think about that for a minute and rate it on a scale of 1 to 10. Where your pain or your unpleasant symptom is right now. Then if you're not driving, I want you to close your eyes and just pay attention to the pain. Put all your attention on it. Breathe into it. What does it look like? What does it feel like? Is it hot? Is it sharp? Is it, where is it centered? What is it trying to say to you? Just be quiet and listen to it. Breathe into it and pay attention. Many times pain is trying to get you to notice it, to notice something. And when you pay attention to it, it will ease up. I experience this every day. So, okay, now we need to come out of that. You can take your mind off your pain. Open your eyes and just do a quick check and see what happened to where's your pain number at now? Did it get better? Quite possibly it did. It does for a lot of people. Laughter is another way, and I wish I had planned to have time to do. We could have done some of this. It would have been fun. Laughter reduces anxiety, raises mood, so it eases pain. And there is even a practice called laughter yoga, which is laughing for no reason. Feel that, the leader will usually get together in a group. You can do it yourself, but it's better in a group, and just start going, ha, 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 ho, ho, hee, hee, hee. You do that. It sounds really faked. It sounds really forced. And that lasts for only about a minute. It starts to feel more natural. Pretty soon you're laughing. You're really having fun. And your pain is greatly reduced. And people do this online. They do it by phone. They get together in groups. And I don't think we do not have time to unmute and do it now. But you can practice it at home, or you can find a place online to do it. So just laugh. Laughing reduces pain. If you probably don't remember, but Norman Cousins, who wrote the book Anatomy of an Illness, healed his very, very severe inflammatory disease by checking into a hotel with some Marx Brothers movies, which he really liked, and just laughed and laughed, and he got better when doctors said it was incurable. Touch is good. Hugs, massage, pleasurable touch of any kind. Studies show that it helps. And sleep, a special shout out for sleep. Sleep is probably the most important self-care practice when it comes to pain, and maybe when it comes to chronic illness in general, because sleep is when the body heals. During the shallow stages of sleep, your body is healing. When you get into deep sleep, your brain and nervous system are healing. And we need sleep. It's not a waste of time. But pain makes it hard to sleep, doesn't it? So there are many things we can do. We can have a bedtime ritual where you get ready for sleep. You quiet down, darken things, quiet things. Get used to it. Evening may be the best time for your pain medicines, so to be more comfortable. Can you find a comfortable, quiet, dark place to sleep? Not everybody has that, but if you can get a comfortable mattress to sleep on, that's great. If you can find a quiet place, if you can't, use earplugs or a headphone. Can you find a dark place? If you can't, use a mask or eye shades, because all that helps. Getting daytime sun helps you sleep because it produces melatonin in the body, which you need. You can also take melatonin as a pill or as a capsule. And be checked for sleep apnea. I definitely want to recommend that a lot of people with chronic kidney disease, a lot of people with diabetes have sleep apnea. You might not be aware of it. That's where you fall asleep and your breathing stops and you have to choke yourself awake to get your breathing going, and you don't remember that it happened because you fall right back asleep again. And as a result, you're up and down, you're awake and asleep all night, and you sleep very poorly, and you don't get the healing benefits, and you're still tired in the morning, and your pain will be worse. So if you haven't been checked for that, it's really worth being checked for. And we need to enjoy life. This is in my book, first book, The Art of Getting Well. You have to have a reason to live. Why are you putting up with this? Why are you going through the trouble? What can you still do in spite of pain and disability? Reason to live can be pleasure. It can be a cause, something you're fighting for. It can be helping others, people or pets or plants. Using your creativity in any way. We've all got creativity. So, writing or painting or music or anything. Learning new things makes life enjoyable and exciting and keeps you going. Pleasure and service to others are good for you, and they reduce pain. So all of that helps. There's a lot of ways to manage it. But sometimes we want to get help from others too, family or friends, especially, or neighbors, somebody to help with the shopping, with the housework, with the transportation, somebody to listen to you, talk to you. That can be very helpful. But professionals can help too, clergy or therapists or health professionals. And whether you have people like that in your life or not, support group can still help. Support groups help about, in studies, support groups help about 50% of people. 50% don't like them. Some people are more social than others. Some groups are better than others. You don't want a group that's complaining all the time and sort of competing of who has the worst pain or who has the worst life. But if you find a group that's focused on problem solving and emotional support, that group might be a big help to you if you like that kind of thing, and I encourage you to look for that. And your family. I mean, remember that like any chronic illness, chronic pain is a whole family condition. People don't know how to treat you. They don't know how it affects their life. You know, what does mama need? What can papa do? What can he not do? How do we help? How do we not avoid hurting? Rarely talked about in families. So you want to help your family members understand your ups and downs, the words you use, the numbers you use. Be appreciative of the help that they give you. And remember that you are still important to them. You're still valuable. You can still be a big help, whatever condition you're in. So in summary, partial summary, chronic pain is an illness. It's not something just in your head. It's not just a symptom of something else. It's basically a whole body condition, especially a neurological condition. It has physical, psychological, and social dimensions. It's closely related to depression, to anxiety. Frequently, there's a history of trauma. It can be self-managed. It can be treated. It can get better, and it can heal. There are many possible drug and non-drug treatments, and it's worth checking them out. Sleep is crucial to pain management, and so maybe start there. Sleep and trauma treatment are for a lot of people, are the most important things. But it's really important to learn to talk about it. Whatever you're going to do, to whoever you're going to do it with, learning to talk about your pain and not being afraid to talk about it. You don't want to talk about it all the time, but being able to talk about it is really valuable. It's a resource list I created. It's mostly websites, which you can't see on your screen right now, but they're going to be up on the website hopefully for a few years, so you can go back and see them. I don't know when they're going to have them up, but pretty soon. There's also a couple of books on trauma on the resource list. It's not a complete resource list. I didn't have room for a complete resource list. If you want more resources, or you have more questions, more comments, or you want to share your story or your wisdom, your experience, you can contact me at nurse@davidsperorn.com. That's the way I prefer to be contacted. If it's an emergency, you can call me at 415-987-1401. And I want to thank you all for coming and for listening and for your participation. Thank you. Turn it back to Kathy.
Thank you, David. We did have a question in the chat room that asked, what are some of the most common pains dialysis patients complain about?
Okay, good question. There was a slide on that, and it includes neuropathy, diabetic neuropathy, includes arthritis. Sometimes people have infections like osteomyelitis. The pain and the pain of procedures like opening access ports and things like that can cause pain. People with CKD also have the same pains that anybody else has, like back pain and headaches, and arthritis. Those are common, but a lot of people have neuropathy, and there is the pain of treatment as well.
Okay, thank you. I was sort of happy to see that you had humor and laughter up there, and some of the various different things like EFT. I didn't see music, and I wondered if you could address, does music have an effect on pain? Is it a distraction, or does it have a different kind of effect on pain?
That is a really good question. Music does help a lot of people with pain. I don't know if it's classified as a distraction. It might be, like sort of harmonizing your brain and reducing stress in that way. music is healing for a lot of things. I've written about that. I should have included more about that in here. I don't know much about what music to use. It clearly should be music that you like. It shouldn't be music that's jarring. It should be music that's more probably soothing, but it should be music that's involving for you. And that's music is healing, and that's a good question. I should have put that in the presentation.
Okay, thank you for addressing it now. I appreciate it.
Thanks for asking, because
like,
people don't think of it.
Yeah, any other questions from anyone on the call? Okay. David, thank you so much for your presentation today. It had a lot of information in it, and I know I'll need to go back and look at the slides, which will be available on our website at the dpcedcenter.org. And for those of you who registered for the call, we'll also send you the link when the recording is up, as well as a link to the slides. And just a final reminder to everyone, please join us next month for our webinar on transplantation with Dr. Keith Melanson, the chief of the George Washington Transplant Institute. And we'll hope to see you then. And again, David, thank you. And if we get any other calls, we will be in touch with you. So if it's about pain. And I encourage everyone to go also look at the webinar on intimacy and sexuality, which is at the dpcedcenter.org website as well. Thank you again, David, and I appreciate everyone coming, and thank you for attending today.